Good morning. I am Dr. Nidhi Agrawal, Assistant Professor in Rama Institute of Paramedical Sciences, Rama University, Kanpur. My topic is rotator cuff tear. Now let us start with the definition. According to the writers and the books, definition is not present, but here the muscles tendon get to be teared is causing the rotator cuff. Rotator cuff framed by the four muscles. First, now we come in the anatomy of the rotator cuff. The muscles which are involved and the frame the rotator cuff are teres minor, infraspinatus, supraspinatus, subscapularis. When these muscles tendons teared, they cause the rotator cuff tears. For the rotator cuff tear, at least two tendons get to be torn. When the two tendons or more than two tendons of the muscles get to be torn, causes the rotator cuff. Right? Now we come into the anatomy of the rotator cuff. Our humerus bone articulate with the glenoid fossa of the scapula frame the shoulder joint. Right? Our shoulder joint is made up of or consists of 5 type of the joints. In 3 of them are the more common, which are working in daily activities life and more active the joints. First, glenohumeral joint, second, acromioclavicular joint, third, scapular thoracic joint, fourth, acromioclavicular joint, fifth is sternoclavicular joint. These are the 5 joints which form the complex shoulder joint. Right? The upper head of the humerus covered with the rotator cuff, right? The lateral side of the head of the humerus covered with the teres minor, next infraspinatus, next supraspinatus, and medially covered with the subscapularis. That point TIS-S. This is the word which is very easy to learn it. The T is stand for teres minor, I for infraspinatus, S is supraspinatus, and this S is subscapularis. This is the easy to learn the rotator cuff muscles. It is the sequence from lateral to medial side. Got it? This rotator cuff is act as a shear or act as a frame form like a structure which shear and tear the frictions when we elevate the shoulder, when we uphead the shoulder joint. Just this frame the rotator cuff, right? And very easily to move the shoulder joint with the articulation of the glenoid fossa of the scapula, right? Now come to the classification of rotator cuff. Here the 5 type of the classification: type A, type B, type C, type D, and type E. These are 5 type of the rotator cuff tear, which is act as a rotator cuff tear when 2 or more than 2 muscle tendons get to be torn. In type A, supraspinatus muscle and the superior part of the scapularis muscles torn. Classification is of type A, when the supraspinatus and the whole subscapularis muscles torn, causes the type B type of classification, and type C, infraspinatus, supraspinatus and the superior part of the subscapularis muscle is torn, causes the type C of the classification of rotator cuff tear. In type D, only infraspinatus and supraspinatus muscles of the tendon get to be torn. In type D, teres minor, infraspinatus and supraspinatus muscles get to be torn and causes the type E rotator cuff tear, right? These are the classification of the rotator cuff tear, in which different type of the muscle tendon is get to be torn, right? Now come to the etiology. This muscle is why these muscles are get to be torn. So many causes are here. First, degenerative changes, age related, when the patient's age or the people's age get to be advanced, the muscles is going in the degeneration condition, and the causes is maybe causes the degenerative changes. Second, repetitive microtrauma, overhead position, more time of the overhead position, at same position the people or the patient do the work and causes the microtrauma, is the reason to cause the rotator cuff injury. That is, it is come in the repetitive microtrauma. Next, severe traumatic injuries. Severe traumatic injuries by an accident or by a fallout stretched hand, they cause the rotator cuff injury. Atraumatic injuries like labor, like throw ballers, these are the people which having no any type of the injury, which have no any type of the degenerative changes, but they have suffered from the rotator cuff injury, that it come into the atraumatic injuries, because here no any type of the pathological changes, no any conditions is come in this condition. This is come into the atraumatic injury. This is all a etiological condition. Secondary dysfunction is come also the cause of the etiology of the rotator cuff tear. Now come to the clinical features. Clinical features, the main pain at the time of the injury, pain for doing any type of the work, pain occur with the overhead activities, weakness of the muscle, shoulder stiffness. These are the clinical features which make the patient unable to do the work. Now come to the diagnosis. Diagnosis, first we do the MRI, right? First we have to take the history before MRI, X-ray, CT scan. Before go to the these procedure, first we have to take the history of the patient, how he or she suffer from the rotator cuff, how they get injured of the rotator cuff, how their rotator cuff injured because of the any age, because of the trauma, because of the microtrauma. There are so many conditions come in this rotator cuff which is present in the diagnosis. 3 types of the test. First test is drop arm test, second is lift off test, third is knee test, right? These 3 tests we have to test into the patient is suffering from the rotator cuff or not, right? Because these tests to confirm the rotator cuff, otherwise we have to make a differential diagnosis so that we confirm the patient is suffer from the rotator cuff or the shoulder joint stiffness or periarthritis shoulder or painful arc syndrome. These 3 conditions which is related to the rotator cuff, and these 3 conditions which can be identified to differentiate between the rotator cuff or not. So these tests is very important to do that by the therapist to confirm their diagnosis, right? Now after that special test, when we confirm the patient is suffer from the rotator cuff, we go to treatment, right? Medical treatment, surgical treatment and physiotherapy management. If only they turn the muscle, turn the tendon and muscles, we no need to go to the surgical treatment. Just only turn, so we have to take the medical treatment and the physiotherapy management. Medical treatment is NSAIDs, right? Painkiller, etc. These muscles get to be relieved from the pain because of present in the rotator cuff tear. And physiotherapy management, we have give in acute phase, we have give ice therapy, ultrasound therapy, right? Next, exercise therapy. When we go, we should keep in mind strengthening the muscle. This is the goal of us, strengthening muscle, right? So strengthening the muscle and relieve the pain, we give the ice therapy and UST, is strengthening the muscle. We should give the isometric exercise, right? Next, come to the open chain kinematic exercise. Next, closed chain kinematic exercises. This is our protocol. It should be very important to make a physiotherapy. First, we have to plan which phase the patient has to suffer from the rotator cuff. When we identify that this is the acute phase, this is the chronic phase, then decide it is the acute phase, to make the protocol that wise. And if the patient is suffered from the chronic phase, then the treatment protocol should be changed according to the condition of the patient, right? Acute condition of the patient as well as the pain of the patients, right? So ice therapy is very important in both condition, acute as well as the chronic condition. And come to the exercise therapy is very important. Most of the conditions isometric should be start to relieve the pain and increase the mobility of the joint, elevation of the joint. And come to the closed chain kinematic exercises and open chain kinematic exercises. Here it is also a very different types of the exercises present in the open chain kinematic and the closed chain kinematic exercises. We can use the wall to push by the patient. We use the physiotherapy ball, apply the physiotherapy ball against the wall, and the patient against by the patient by put into the ball. Different type of the pattern we use to create the closed chain kinematic exercises. For open chain kinematic exercises, patient do the 90 degree external internal rotation. Patient can do the elevation with the elbow flex at 90 degree and raise the elevation, raise the shoulder and increase the elevation of the patient. Just as it passes the time, patient increase the mobility and increase the dynamic activities of the daily living. These protocol improve the patient's condition as well as reduce the pain, and the patient will be able to do their work in daily activities. Thank you.